Hello everyone and welcome to this presentation. First of all, we wish to thank the GreyNet International conference organizers for giving us this opportunity to deliver our presentation. It is indeed an honor and a privilege to address such a distinguished audience. My name is Sangeeta Narang. I am Librarian Selection Grade at JPNA Trauma Center of All India Institute of Medical Sciences, New Delhi. This presentation is prepared along with the faculty in charge of the library, Dr. Richa Aggarwal, who is the additional professor of critical and intensive care at the Trauma Center of All India Institute of Medical Sciences, New Delhi. As you can see, the title of my presentation, it is on enhancing access to Grey literature and data in health sciences. In this presentation, we will cover introduction to Grey literature, importance of Grey literature, sources of Grey literature, objectives, methodology, coming to the relevant studies on Grey literature, relevant best practices on road traffic injuries, intersecting studies on Grey literature in health, followed by observations, results and conclusion. So, what is Grey literature? It is important for us to understand the definition of Grey literature. It stands for manifold documents produced in all levels of government, academics, business, industry, either in print or in electronic format that are protected by intellectual property rights of sufficient quality to be collected and preserved by library holdings or institutional repositories, but not controlled by commercial publishers. That is, when publishing is not the primary activity of producing body. These are some of the examples of Grey literature: bibliographies, discussion papers, newsletters, presentations, technical reports, dissertations, patents, catalogs, speeches, reports on websites. These are some of the a table which shows the numerous forms of Grey literature. This is a similar structure where the various information channels have been represented in a different format, and there are the three tiers which have been represented here. So, yeah, this is it. Books, journals, book chapters, they are easily discoverable, but if the second tier, which is of moderate retrievability, that constitutes your conference reports, presentations, Wikipedia articles, and the third tier constitute theses, data sets, institutional repositories, and the informal forms of communication. Those are the emails, tweets, letters, LibGuides, catalogs, preprints, reports, and reports on websites. They constitute the low retrievability and many a times of less credibility. Another paper where author Dr. Adam Stay and others have differentiated between among the Grey literature, Grey data and Grey information. Grey literature, as has been said before, it is not controlled by commercial publishing, and within them are the examples of internal reports, working papers and newsletters. Grey data, that is user generated most of the times, that constitutes the tweets, blogs, Facebook status updates. And the last is the Grey information, which is informally published or not published at all. That constitute your emails, personal memories and the meeting notes. Now coming to why Grey literature is important. So, Grey literature offers insight to more up-to-date evidence in healthcare. It may affect the findings of systematic reviews. It offers better opinions for realist reviews. It provides fair understanding on emerging disciplines. It helps to bridge the gaps in empirical evidence needed to effectively respond to a calamity. It offers valuable source that contributes to academic performance, enhance research output and enrich quality of research. For that reason, it is important that we care for the Grey literature. These are some of the databases that constitute Grey literature. The Grey literature report, that is by the New York Academy of Medical Libraries Grey literature collection. The Open Grey, that is a system for information on Grey literature in Europe. Grey Matters is from the Canada. The GreyNet, Conference proceedings, Web of Science and Scopus, these are the subscribed resources, and they cover, most of the times they cover the conference proceedings. The other one is dissertations, as we know about the common databases, that is NDLTD, OATD, ProQuest, and then we have the trial registries, that just like the clinical trials. These are some of the relevant international studies on grey literature that we really found are very important when we were doing this research. One is by Adams, the topic of his published paper was on shades of grey. The another one was on effectiveness of the interventions when we consider grey literature for meta-analysis. The third one on the right is the importance of grey literature in systematic reviews, and the last one, that published paper is by the librarians, where they advocate for the diverse, they say that grey literature helps to advocate for diverse voices, it increased the use, helps increase the use of grey literature, it offers the improved access, and preservation of grey literature is important. These are the two important studies from India. One is the information systems for grey literature in India, a model. This is though an old study, but found to be useful. And another one is a wonderful study, as you can see by the title. Is grey literature really grey or hidden glory, to showcase the sleeping beauty? That's what it means, you know. Many a times there is something hidden. One is accessible layer, another is a hidden layer. So maybe in the hidden layer a valuable resource is lying and we are unaware. So it is so important for us to showcase those hidden glories. Now coming to the case study for we have considered road traffic injuries as a case study for identifying the grey literature. So as we often read in newspaper, horrific accident, one killed, MBBS students died, and another, speed kills. There are so many everyday news that we hear. Is not there a way that we can reduce such accidents? So this was a topic that we chose, and we tried to identify the best practices available to reduce such harms. Here it's showing, you know, it happens, we get distracted. Such sites, they are obstacles. It's likely that we are going to fall. There's need to minimize such accidents at least. This one is a pothole buster. Thank God we have busters wherein we can reduce the potholes. These are the statistics on road traffic injuries. One is by World Health Organization from Global Status Report. The annual road traffic deaths have reached 1.35 million in 2016. The Sustainable Development Goals target is to reduce road death and injuries by half. And in our scenario, the Ministry of Road Transportation and Highways have reported 4,64,910 accidents, wherein 1.47,913 lives were lost. And then there is a national program for prevention and management of trauma and burn injuries by Ministry of Health and Family Welfare. We know accidents happen anywhere, anytime. Most road accidents are avoidable and preventable collisions. The most heartening thing is when the young people die. They are the wage earners. And the burden that the family, the country has to face. This is again, this particular chart shows that road injury, it's the 10th leading cause of death in low and middle income countries. The research camp, the level of utilization of grey literature by research communities is almost absent in medical colleges, or I may say minimal. We do not find very frequently the use of grey literature. Then many of the references that we, when we were doing this research, we found that grey literature is hardly being referred to. And then resource centers do not inform the importance of grey literature to the scientific and academic communities. Our study objectives: to demonstrate the sources of grey literature for finding evidence in healthcare, to provide best practices on road traffic injuries and road safety in the Western world, to inform grey literature sources on from India concerning road traffic injuries, to educate academics, professionals and policymakers about the use of grey literature in scholarly communications. The methodology of our study, it was a mixed method search strategy. It wasn't easier for us to find the grey literature sources from India. So the various sources, initially we used PubMed search to identify whether the published papers have referred to grey literature. We have visited the websites of the of WHO, World Bank, and then preprint repositories were visited, conference proceedings, clinical trials, thesis repositories, sometimes targeted, we had targeted to particular websites, and then Google search engine was often used. So our basic search terms used for road traffic injuries and grey literature. In India, we have limited our search for title and abstract. Time period we used for 2015 to 2022, and English language was the preferred language. We have also used combined search on Google search engines to identify grey literature and road traffic injuries. And as we know, it wasn't easier to restrict just to road traffic injuries. At times, there were the different search terms that were used, and just like road injury, many a times it was motor vehicle crash. So we have considered the importance of these terms also to identify the road traffic injuries. This is almost the same workflow. Initially PubMed search, databases of grey literature was searched, Google search engine, targeted websites, and many times even hand search was also conducted. It's almost the same thing. So references and citation searches backward and forward were conducted, Web of Science was used, Embase was used, thesis repositories were used, government websites were visited, and international organizations' websites were visited, even the institutions, what they have published. That was also taken into consideration. So these are the common resources on grey literature. There is a book by Grey Literature in Library and Information Studies. This was found very valuable when I was doing this research. And then we can see on the left is the Grey Matters, that is by Canada. Then at the bottom is GreyNet International, Open Grey, and then DANCE is their Netherlands data repository. Then we have got a grey literature report, so on, and then Oyster, the poll. Okay, these are some of the reports that are published by World Health Organization. These are again the publications by World Health Organizations on road traffic injuries. Coming on to to this particular website where we identified that they also offer from Europe the statistics on road accidents and injuries or even safety. These are the sites, Indian sites, where the one is the report on the right, that is on road accidents in India. This is and to the left is the Ministry of Road Transport and Highways. So this is one of the very essential publication on rather a report on road accidents in India, and which is most often being referred by the doctors and the research communities. Coming up, there are other publications just like Accidental Deaths and Suicides in India, which is published by National Crime Records Bureau. To the right are two other reports that is produced by NIMHANS in Bangalore. That's on implementation is the key, facts and figures. These are the two reports. When we were doing search, we were able to find them. These are, the World Bank has their blog, which says that how a state is leading, in India is leading the way to lower road crash deaths. This is one of the case study where they have represented that Tamil Nadu, where the accidents have reduced. To the left is a Gazette of India, that's a government publication. To the right is another status report produced by, that is called TRIP, produced by Indian Institute of Technology, we call it IIT Delhi. So for that matter, committee meetings, they also are of importance when you consider grey literature. And then to the right is the foundation, Safe Life, along with, they have collaborated in this particular publication was produced. These are National Library of Medicine when we were searching for grey literature and then were trying to identify publications from India. So this was mesh terms that we were able to find, and then woods and injuries was obviously a different search term for mesh. The Institute of Health Metrics and Evaluation in US, they have produced numerous reports on different types of diseases. They have analyzed the research and have offered the data tools and practices. This is one of the valuable resource considering the importance of data in current times. The CDC, the Center for Disease Control and Prevention, they have Injury Prevention and Control Center, which offers very useful publications. They also have a Twitter handle where they inform the communities about road injuries and safety. This is again Medline Plus, where they have provided the patient education material. This is a site from Europe, OpenAir, where they have provide data as well as research publications from Europe. This is again a data repository. This is a World Health Organization clinical trials registry platform. As you can see, there are a number of clinical trials on road traffic injuries. This is one particular clinical trial from India that we were able to find from clinicaltrials.gov. This is one of the very valuable resource. This is a preprint. Many a times it happens that your journal publication takes time, and authors find this study is valuable. They publish it in the preprints. This is mid-RXIV. This is developed in collaboration, supported by Chan Zuckerberg initiatives. This is another course which is conducted by Johns Hopkins University. There are projects on road traffic injuries, just like clinical children's safety network. Now coming to some of the relevant international studies on road traffic injuries. To the left, how important are the trauma registries? In between, there is the data. There are challenges in managing data, in representation of data. Many times it gets lost, and what are the ways that we can reduce data errors or something like that. It is represented in the second one. Then to the right is where they have represented the grey literature, and to the bottom is another useful research paper where they have shown how the road traffic injuries can be reduced in Africa. As you know, Haddon has published numerous papers. He is the pioneer on injury prevention, an epidemiologist. So what he has shown, there is a pre-event, event and post-event, and likewise there is a host, agent, vehicle, physical environment involved and social environment. So each of the nuances have to be carefully studied to reduce the road accidents. This is one of the valuable study from the librarian's point of view, where they have shown that there are numerous disciplines involved. We cannot say just the healthcare which has a role to play, or just the engineering discipline has a role to play. Every discipline, whether we consider from the psychology background or we study it from the other perspectives, the study is very important and shows how that improved access is important. So this is one of the visualization tools. Unfortunately, it has not come as a full depiction, sorry for that. And this is from worldwidescience.org. These were the publications from worldwidescience.org. These are some of the Indian publications. They are really useful. We were not able to find it from other sources, but we were able to find that they are from the data is in the Zenodo data repository as well. So these are some of the searchable websites from where you can find road traffic injuries. This is one particular platform. This is another wonderful platform by Great Britain, and that is on Road Safety Knowledge Center. These are some of the relevant studies from India. To the top is road traffic accidents in India, their issues, their challenges and how they have to be managed. To the bottom is a publication from AIIMS. It is an epidemiological study that is performed in trauma center where I work. These are other studies. One is the bibliometric study, and to the right is the multi-center trauma registry that has been established in trauma center, which is a collaborative work of Australia, India trauma systems collaboration. And the other publications, they are also of great importance when we were reviewing it. As you can see, one is the official government statistics. They have underrepresented the road traffic deaths. And then Bir Pal, he has published along with others several publications on road traffic injuries. Then another one where they have over 1.1 million homes were surveyed to assess the road traffic injury mortality. Both of them are road burden of disease studies, as you can see it here. And what is happening, how much amount, how much money we are spending on hospitalization, is that really required? Cannot such diseases be prevented? These are many times it happens that you ignore magazines. So this is one important magazine, Economic and Political Weekly, where there were publications on road traffic injuries. These are some of the intersecting studies on grey literature and health, where in one study they have studied school-based breakfast programs. In the bottom study, they have evaluated the effectiveness of digital health and welfare technology. And to the right is the most important one, that is systematic interventions for injury prevention. That is the importance of grey and unpublished literature, which is also of great use to us. These are, we have got Shodh Ganga. This is our country's repository, where they have numerous theses available for the readers, for the researchers to consult. Most of the times it has been observed researchers are unaware of it. Likewise, we have Digital Library of India, which is least used, but they offer several resources of value. So what are the challenges? These are some of the challenges when we faced when we were doing this research. It's a time consuming task, requires multiple databases search and multiple sites were visited. There are variable terminologies, methodologies, reporting criteria. Many times grey literature is not peer reviewed, many times metadata was not accessible. Then there was not proper archival of such resources, also language constraints. Coming to the observations, we observed large number of publications addressing grey literature from Western world. There were blogs, websites, visualization tools, courses, patient education materials, repositories available on road injuries and safety. From India, most of the publications referred to WHO reports or the government reports. We also found that there were involvement of AIIMS and IIT. They have collaborated in developing resources for road safety. And another one is we do not have any particular database on grey literature. Results: in India, importance of grey literature have been overlooked in research and practice. The reviewed articles from India do not address valuable information channels supporting grey literature in their scholarly publications such as theses and preprints. In Western countries, there are databases on grey literature, libraries have maintained guides on grey literature, institutions have developed institutional repositories. The application of FAIR principles, integration of resources and data across repositories and regions in the country was not observed, whereas in Western countries, they follow the FAIR principles of research. Coming to the conclusion, this study informs importance, use and integration of grey literature in evidence synthesis and when conducting systematic reviews, especially areas concerning public health. Grey literature aids to reducing publication bias and includes evidence for interventions where bibliographic databases may not have been indexed them. The establishment and maintenance of an Our road traffic injuries repository, as well as the collection of numerous sources of credible grey literature on road traffic injuries, is critical for identifying best practices in the country and making road safety a priority. Now coming to the recommendations. For us, it is necessary to selectively index grey literature and raise awareness about the importance of grey literature, particularly when conducting systematic review in medicine. There is need for us to develop the resource guide for grey literature, and then a platform for managing and preserving resources related to road traffic accidents and safety protocols. With this, we come to the end of the presentation. Thank you for your attention.